Rheumatoid arthritis or RA is an autoimmune and inflammatory disease, which means that the immune system attacks the healthy cell in the body by mistake, causing inflammation in the affected part of the body. RA mainly attacks the joint, usually many joints at once, and traditionally it is diagnosed using conventional radiography. So, what's the problem? The problem is that the conventional radiography is not sensitive enough in detecting the presence of the disease, especially in early stage. Plus, the RA feature is joint erosions. The erosions can be only detected after several years of the disease if used the conventional radiography. To have more cost-effective and efficient treatment, early diagnosis is needed. Thus, a more convenient and sensitive imaging modality is needed to diagnose the RA. The first research question is, what are the advantages and limitations of the US compared to other imaging modalities in diagnosing RA? Second question is, how much the accuracy of the US in diagnosing the RA? For objectives, we got two research objectives. The first one is to evaluate the function of US compared to other imaging modalities in diagnosing RA, and second objective is to evaluate the accuracy of US in diagnosing RA. Meanwhile, our first hypothesis is US might be a better choice as the initial RA diagnosis compared to other imaging modalities because of its availability, low cost, convenience, and has no ionizing radiation. Our second hypothesis is the accuracy of the US in detecting the RA is enough and good, but it is limited resolution for deeper joints.
Rheumatoid arthritis is known as a chronic autoimmune joint disease that causes inflammatory arthritis as well as extra-articular involvement. It often begins in tiny peripheral joints, which is commonly symmetric and can continue to affect proximal joints. The 2010 American College of Rheumatology and European League Against Rheumatism stated that rheumatoid arthritis can be assessed by a number of variables, including risk factors, the count and type of the associated joints, and the duration of the symptoms.
Musculoskeletal ultrasound (MSUS) is becoming increasingly popular among rheumatologists, particularly in the case of rheumatoid arthritis joint evolution, because it is a non-invasive radiation-free imaging modality that is reasonably simple to set up in a clinic setting. It was preferred due to its higher sensitivity in clinical practice for RA diagnosis and follow-up, especially in diagnosing inflammatory lesions and intraradiographic erosions. According to this article, the US can differentiate between thickening of synovial, basic abnormalities of tendons, ligaments, small erosion, and ectasis, which will help in more accurate diagnosis of soft tissue assessment in patients with RA, allowing early diagnosis and correct classification of patients. This is confirmed by this study where using ultrasound score for erosion, USSE is capable of detecting erosion progression at a joint level in the early stage and classified patients as progresses, stable, or regresses. There are two crucial properties of MSUS in the evaluation of RA, known as grayscale US and power Doppler US. GSUS can detect minimal RA synovitis. Meanwhile, PDUS can detect active inflammation by measuring pathologic synovial blood flow and neoangiogenesis. Moreover, according to several studies being studied by this article, the presence or absence of inflammatory blood flow signal of chronic synovial hyperplasia in RA patients also can be detected in the Doppler US. Furthermore, in this study, the authors state that the use of MSUS to track patients in remission can better predict who will have subsequent joint injury and illness flare-ups. When using US as the tool in diagnosing chronic RA, a bushy appearance of circumscribed polypoid structure of synovial hypertrophy may be seen. Various characteristics and the distribution of cartilage degradation may be examined in great depth, and bone erosion as small as 1/10 of millimeter also can be discovered when using US.
In discussing ultrasound accuracy for rheumatoid arthritis diagnosis, an article, Reliability of Ultrasound for the Detection of Rheumatoid Arthritis, stated that the grayscale ultrasound GSUS and power Doppler ultrasound PDUS can detect synovitis and early bone erosion in rheumatoid arthritis patients. From the result, GSUS recorded 83.5% and 79.8% of sensitivity and specificity in detection of synovitis of small joints. Meanwhile, the average sensitivity of specificity of ultrasound for the detection of early bone erosion were 58.385% and 93.859% respectively. From the reviewed article, ultrasound can demonstrate an exceptional accuracy, sensitivity and specificity in identifying synovitis, bony erosion and soft tissue swelling in rheumatoid arthritis patients.
The study involved the population of the patient with rheumatoid arthritis conditions. The intervention of this research is ultrasound examination. The control or comparison group for this research is the currently used examination. The outcomes of the study is ultrasound have a greater accuracy in detecting RA compared to other imaging modalities. The study is expected to be conducted within 16 months starting in April 2022 until July 2023 and will be conducted at Sultan Zainal Abidin University, Terengganu, Malaysia. This study is a systematic literature review that aims to evaluate the role of the ultrasound in diagnosing rheumatoid arthritis. Inclusion criteria involve the study on rheumatoid arthritis patients with ultrasound function. Advantage and disadvantage of ultrasound also include the discussion of the ultrasound image of the rheumatoid arthritis. Last but not least, inclusion criteria include the study that discuss about the accuracy, sensitivity and specificity of ultrasound. However, exclusion criteria is animal study, review article and the study that do not answer the research question. For the search strategy, the study is conducted by using a systematic search method based on the preferred reporting items for systematic reviews and meta-analysis PRISMA guidelines as shown in the figure. The study is conducted by using PubMed and the keyword used for literature searching were entered as rheumatoid arthritis and ultrasound, not review, not animal study. The publication's date is restricted from 2010 until 2022 in English literature. A final database will be produced when all the records were gathered after the duplicates removal, followed by screening via titles and abstracts. The data will be extracted by using this form, but for the part intervention and setting, the one that I circled will be changed to the ultrasound or Doppler or musculoskeletal ultrasound or grayscale ultrasound since our study will focus on the ultrasound. For the quality assessment, we will use JBI Critical Appraisal Checklist for systematic reviews and research synthesis. This appraisal is specially designed for systematic literature review. This is the flowchart of the research activities. It divided by 3 phases, which the first phase begin with the selection of the study area. After that, formulating the research objective and design. Next is literature search, followed by preparation of research proposal, then proposal defense. For the second phase, starting by collecting data, then data interpretation and result reporting. For phase 3, it includes the manuscript writing and lastly is thesis submissions. This is the Gantt chart and milestone of the research activities. Selection of the study area is conducted in April and ended on 13 April 2022. Next, formatting objective and research design also had been done in April and ended on 15 May 2022. The literature search has been conducted during April until 29 May 2022. Preparation of proposal is starting in April until July 2022 and proposal defense also in July 2022. Next is data collection that will be conducted within July 2022 until 15 December 2022. However, for data interpretation will be begin in January 2023 until 20 March 2023. At the same time, manuscript writing is already begun since July 2022 and expected to be ended on 30 June 2023. The thesis submission is expected to be on 31st July 2023. And lastly, since our research is SLR, which is the secondary research, so it does not require ethical approval. So that's all from us. Thank you.